the Kush fete and all of that. You know, somebody sent me a message yesterday, and where I read I tell everybody thank you. We've been contributing when we started, when we raised alarm about Kush. It was like it gets a family person. We've been so addicted, and it been almost give up on them. But the moment we started here and begin ask people and I post you are connect with one of we guests we there. You know, I share in contact with him, even reach out to him, and he give me feedback, say social welfare have been so responsive, they don't take the person, they don't care and go rehab. And he was so happy that the guy don't come out na the rehabilitation center, and he's better now, don't go back na school and don't be a change person. So some of them things, and I don't get a lot of people who go meet me in a street, just hold me hand and say, thanks for doing that. You raise awareness, you make we not left for picking in a street. We don't take them back, we watch over them, we don't carry them go to rehabilitation center. So I got two people when we started. You know, we first guest this morning, Dr. Lebo. I remember the first program we start now, and I've been with first guest because I've been able to talk about certain things that with me personally been on the go through and how we could use that for raise awareness and teach other people on waiting for do when they get stressed and things that we monitor them. So I get the pleasure this morning for welcome at the studios, Dr. Carol Lebo, we're a senior advisor on mental health and technical lead na the National Mental Health Secretariat. A presidential appointment, she advised the president on mental health issue. Good morning, Dr. Lebo, and welcome.
Good morning, Lamana. Thank you for having me.
Thanks for joining us. I also get my very good friend, Ansu. I don't say what the fetch for. And I'm busy right now. He's all over. I don't say what the fetch for bring and come. He's the Director of Mental Health and Psychosocial Support Services at the Ministry of Social Welfare. Good morning, Ansu, and welcome.
Good morning, Lamrana, and good morning to all the family.
Yeah, thanks so much. I don't get a lot of requests from people how far we don't go with the fight against Kush, who side with this. So Ansu can give you updates. There's been progress and the resource there now, you know, so like how the rehabilitation and the center have been closed. So Ansu can give you updates. But I'll start with you, Dr. Lebo. 65 years of independence. I just mentioned just how you go meet somebody in a treat no more vexed by you. For sometimes small thing, you go begin imagine why this person the vex so. Is it because we've not been able to discuss or get a conversation about mental health and well-being at this country since after the war and things same way to happen with we?
Thank you for your question, Lamrana. I think in terms of Sierra Leone, 65 years, Usai Day in our mental health and well-being, it's very fragile. It's fractured. You have 65 years. We've been through the war. And even Ansu can tell you that the trauma from the war, even trauma that predates the war, is still amongst us. Mm-hmm. We have historical trauma within our society, within our culture, where you do talk about people that get angry fast. Anger is an emotion. So we all get emotions. And all man vex. But what do you do with that anger? How do you process it? Mm-hmm. And Nadande, we really need for buck up in this country. We have what's called complex trauma. When we talk about even the colonization, mm-hmm. there was a lot of trauma around that for even for Salon to be colonized, even going back to slavery. So this is something where we really need to confront because we can't keep turning blind eyes to it. Because it develops, it will continue to not like soup very well. Pot, it'll spill over, and that's what you're seeing. People that really vex, small thing then vex, and even when you talk about what we term the social determinants of our health, social determinants of our mental health, financial issues, our physical health, our mental, the psychological state of our well-being, all of that has been fractured by our traumatic past, and this is what we have to address.
And how much have we tried? You know, you advise the president. We to a very large extent, you know, very recently, we see the kind of attention we, you know, did to mental health issues, with the drugs issue. A lot of people, they discuss them now. Waiting at the support system where we get with this fragile, you know, mental health status where you don't mention. So waiting at the support system where you think say they.
So, for one, I would say in the history of Salon, historically, we still only have one psychiatric center, which is the Kissy Hospital. You have Partners in Health that supports the hospital in Kono. And then you have trained nurses. I believe it's about 19 nurses, about 4 psychiatrists. And so we don't have enough of the healthcare workers that we need. In terms of WHO recommendations, I think it's about less than 1 psychiatrist for every 2 million people. Not Salon. If you truth say talk to me, we're on Truth Media, right? And so we really need to start at the bottom. We need to build up the health workforce. We need to utilize a multi-sectoral approach, which means it's not all man infects, not to one person infects. And this goes beyond having activities. We need to build a system of care. We've been working to build the ecosystem, the mental health secretariat. Like I started saying, we have the one hospital. In his wisdom, His Excellency, the President, appointed me in 2022, and which was the first time that a big step outside of the hospital has been made to really take a holistic look at our mental health and well-being. But building a system, not easy. It's not easy. People are resistant to change. You have people that still have the mentality, "Usai come out, usai been there, we don't there." Yeah, you know, so now
Like JC.
this is it. And Afro, that's JC said. Because you know, my English accent is like, it was like this one come out. So that challenge, but I believe that with time, things will change. We've established the Presidential Task Force on Mental Health,
But that was launched in 2023, right?
It was launched in 2023, and the Kush epidemic really it took precedence. Anything, you know, it takes precedence because you have that direct impact that was needed with the Kush. But I think it's time now to revive the Presidential Task Force on Mental Health. We also established the Mental Health Secretariat that I lead by cabinet, and it's time. You know, just like the last time with Ansu, funding is an issue.
You still get resource challenge?
Yes.
Yes. But how is that affecting your work? Because it's important. I remember the last day we were talking, you were talking about directives where president himself don't give, you know, providing official vehicle and resources to you. How functional, you know, you able be, you know, for provide the advice and support to the mental health system in the country?
We're still working on it. We're fighting every day. It's a challenge, but I believe, you know, like we all day out for a reason. We day out for a purpose. And I believe it'll work out. Because if you say, you know, oh, they not give me this, they not give me that day, I don't get for do nothing.
But you need that thing then for able to function well, for do your work. Otherwise, it'll be people who understand she was appointed by the president, she has a job. And if you not get the tools, logistics for them, then you will not be able to function well. That's the reality, right?
It is the reality. But I've been fortunate that through this appointment, through the awareness that we've been raising, I've had a lot of external support. I mean, I've been to, you name it, the country, you name it, I've been waving Salon's flag and what the vision is for mental health. And so I would say before 2022, there was a lot of trainings done. Every time an emergency happens, you get people that wait and they train, infuse psychosocial support into the system of care. But now I believe it's time for us to build that system of care. So which is what we're trying. My office is now being embedded within the National Public Health Agency, because this is a public health issue. Mental health and well-being is a public health issue. Again, 65 years, you have people that are living with trauma. People do not wake up, they don't wake one day and they're addicted to drugs.
Yeah.
A lot of times it's maladaptive coping skills. They're using various coping mechanisms to heal themselves, they think, to deal with their hurt, deal with their pain. And then let we not forget, say, during the war, you had 11 years of interrupted childhood. All in beginning, with school no day, the system wasn't functioning. What happens to them? What has happened to them now? And you'll see, if you look at the chronological age of the individuals that are addicted, they fall within that 11-year period. I call it childhood interrupted.
Yeah.
Their childhood was interrupted by war, disrupted by war. And if you take the normal stages of child development, 0 to 10, it was interrupted, where their brain is being developed, where they're learning various skills, social skills, emotional regulation, social emotional learning. All of that was interrupted. And so how we go up there now? How do we help the country as a whole? Because whether it's Kush, whether it's depression, whether it's schizophrenia, not to one man walk. And not to one man it affect the one whole family, it affect the community. I mean, I get so many calls, people that can call me emergency, Dr. Carol, this, Sunday.
You don't under pressure.
Yep, yes, because what do you do in the middle of the night? If a person they call me in the middle of the night, the only thing I can do is either refer them to Ansu, a director here, or refer them to Kissy Hospital. And this is the thing. So I think with more trained individuals through Global Fund, then we were able to train 1,090 individuals. And unfortunately, that funding has stopped. But we do have those individuals that we have trained, that we have in a pool, which we piloted. I developed the curriculum for training, and it's really how do we scale up.
Okay, we can talk about the survey we have been doing as well, and how then they help for make we get an understanding. In a country who say people should believe as well mental health issue na a spiritual problem. But Ansu, who say we dey presently with getting our young people, the president himself referred to as victims of kush and other substance abuse. Who say we dey waiting don't be the progress. The last time I get it was about the rehab centers and closed, money no day. Has that changed?
Yeah, so you're truth media,
Yeah.
so we need to tell the truth.
Yeah.
Of course, that was the truth, but the reality is from that end, plenty things change. We even lead to admission of 200 young people into the rehab centers they will get. We just don't conclude the discharge ceremonies. So from that end, we admit 100 at Hastings, PMTC, we admit 50 at Gunama, then we admit another 50 na Daru. So just don't discharge the young people there. I just come on Daru yesterday. And additionally also, the other progress we don't make, we establish a rehab center at Kono and Makini. Just 2 weeks ago, the condition of the drug issue in terms of the victims na Kono is very devastating.
Yeah.
The thing that I see now Kono, it don't take 2 years one will see them. Because on them pen that they never seen Kono as a result of drug addiction. The last time I said 2 years ago, in Freetown, we'll do community engagements now 10 communities. So it's very serious. But the good thing is that the governments will establish a center here. And currently, even though we don't discharge 200, and then 3 rehab centers here, currently, the MTG, we get 100 within Kono and Makini. So hopefully, once we don't get more resources, we admit now the 3 centers we just don't discharge. So I think we don't make huge progress.
So the one day more the discharge, I don't see a lot of process of discharging, the one day where they come out. Waiting at the process, within left. How una they use them possibly for help with community engagement?
Yeah, you remember I've been telling you, we refer to as ambassadors of positive change. Now when they work very, very closely. Of course, Carol herself, a good coincidence for letting you invite Carol like because we don't work previously around the reintegration of the ambassadors. We don't organize peer group sessions that are after rehabilitation as part of their integration, for ensure say we still stay in touch with them. We do follow-up measures. We work with other partners, including the Ministry of Basic and Secondary School Education and Ministry of Youth, for ensure say we want them we don't drop out of school and colleges, then they go back. Because the data, they really show about at least 60% of the young people there picking up the drop out of school and university. We're very alarming. So we work with their institutions and they for ensure say you will go back school, you will drop out of school. We support you for go back school and university. We don't really succeeding. The one who are going to skills, we work with other partners like BOSO, OIC. They really support a lot. And then recently, the one that we don't graduate na Daru, we get about 10. We come on Kailan, we don't get partners. We're ready for support them into skills. Then even Daru this time, we get from Daru to about 10, then about close to 30 from Kenema for the rehab center. So we get partners that we work with, for ensure so the young people here then go back into education and go back into skills, so they will contribute meaningfully in communities and also reintegrate with their families. That's a big issue that day.
The last we talk, you've been talking about the waiting list. Where people where they wait for una get them picking them in. It don't reduce the pressure on number of people where they come.
Even though as at yesterday, where we don't rehabilitate, close to 800. Just imagine, still 800. Plus the other 100 within inside it, hopefully by mid-June, we go down close to 900. We not still reach 1,008. We still get over 2,000 to 3,000 on the waiting list. We still get over 2,000 to 3,000 on the waiting list. So what do they do? They're going to Ministry of Social Welfare offices them. We don't create like some one-stop centers. We social workers that they provide psychosocial interventions. But we're still need for care young people then going to rehab, because rehab not the safest side for them. But they need to rehab, would they keep them off drugs? They would try for educate on the dangers of drugs, and also for help them for build resilience, because after rehabilitation, then they face stigmatization in the communities, and then we'll also teach other techniques them for reduce the risk of relapse, because if they go back to drugs, it will be more devastating than previously.
That number they on waiting list, so is it about capacity, resources for get them in, and then the challenge?
Well, of course, say na only 2 weeks ago, we able to add 2 more rehabilitation centers around the country, which is really, really good. We maximum we were able to admit 100 at the time with our Hastings because of capacity. We can, if we get more resources, we're able to expand the other rehab centers. So definitely, if we get more money, we expand their centers, and they will really help for save the lives of more young people with not drug addicts.
So far, even with the expansion, we not get the government system not get the capacity for able, taking the number of people we won't have register.
The data I don't give so. The data I don't give so. By June, once the 100 don't come out from Connell and McKinney, will they reach close to 900? So it's very good for we expanding centers them, so that more and more young people will get access to rehabilitation. Because Jellica say rehabilitation not the safest side for them, because if they keep them off drugs, and that make some man die in the street because they don't get that kind of care. But now rehab centers, because now a multi-agency approach we use, is very helpful for young people for changing their lives. I'm even glad for we set the pace this morning for give a good testimony about how somebody don't reform from rehab. These are realities. We not ever get to 100%. The relapse rate is minimal, but to be very honest, rehab is very helpful because it change lives. And the more we do, the more we able to save young people.
Yeah, I can say it. I don't share you contact with a lot of people where they go call you and they come back to me and say, okay, that man being very responsive and helpful, and they don't show say people accept that the need for care them picking them good day and all that. Doc, as you just mentioned something, and in February when I do mental health provider survey, for look at the people who they provide this service. What's clear now that government alone not able to provide this service. And earlier, the last time I get you, we talk about people in way they create makeshift or so where they take in people in some na prayer and they provide some na ritual and all that. What's in we get presently in terms of say apart from governments and other people where they provide this service to people where don't get problem with substance abuse?
Thank you for that question. So, yes, we did a national mental health and psychosocial support survey, and it's still ongoing because what do we want to do with support from ECOWAS? We want to identify the people that where they provide the various services. Just like Antu say, where people that they come on at the rehabilitation center, there has to be a continuum of care, and we need to make sure that it's structured in a way where then they report their activities, their support to the ministry, whether it's the Ministry of Health, in this case, Rehabilitation Centers, Ministry of Social Welfare. And so it's ongoing. We're going to have we have a consultant that will complete the reports, and then we'll do a validation meeting and take it from there, take the recommendations. But in all honesty speaking, we have a lot of people. About 2 years ago, we did an informal survey. 179 individuals reported that they were providing some type of care. But now when you begin ask, what do they do? The members say we want to shut them down. No, we want to build on our capacity. So now we're able to help the people them. Let we show now how to do intake, how to do record keeping, how to do evidence-based interventions. Because yes, everyone believes in prayer. People get what they do with individuals, but there's a way. We have what's called the minimum service package, right? And with the IASC and the standards. So we just want to have some standards around waiting people that they do and support them that way. So that way people that they come on, whether it's rehabilitation center or even if they come on like Kissy Hospital with a psychotic episode, when they come back now the community, there's care. There's a continuum of care. It's evidence-based, and someone's held responsible. Because go just say, oh, I did do mental health. Sabi, uda for call. Sabi stabilization if someone has a breakdown. And with rehabilitation, once they go in and that detoxification period is over, they need intense support. And when they come out, to reduce the rate of relapse, they need intense support as well. A person go back to the community, service providers for the community, for help them to reduce the relapse rate.
Presently, do we have any policy, say, where they regulate possibly the private sector or individuals where they set up their care center there?
So what we did with the Mental Health Secretariat under the National Public Health Agency, we wrote MHPSS provider guidelines. That's mental health and psychosocial support provider guidelines, and it was launched. It was launched in 2025. So we do have guidelines. So the challenge is the regulation side. Even with some of the rehabilitation centers. So anytime somebody can come to me, ask me about a rehabilitation center or ask me, I can always say the person, they get SLA, which is a service level agreement with the Ministry of Social Welfare, with the Ministry of Health. Because if you have a service level agreement, it outline what kind of services you can use. But the reality is if somebody not gets and they and people then they go to them, there's nothing that we can do. And again, we don't want shut them down. We want to build their capacity. We want to build them up because there's not enough of us. We've been fighting mental health, dealing with trauma in this country before the past 65 years, before even colonization was over and we gained our independence. So it's high time that we take a look and build the system because it's very fragmented. You will get yanda, and you can't you're not able to put your finger and say, now this many people then we get. And so with the survey, that's what we want to do. It's a mapping. So at the end we can say, 10 people then they Kailan, they can build their capacity. 15 people then they we can build their capacity. That's what we want to do with the survey.
Is there an opportunity for, say, an investment in this as a private sector investment in them and with the rights regulation?
Well, in terms of private sector engagement, the challenge is the rate of return, honestly, because if somebody to go into it as a private sector, as an investor, they're looking at the rate of return. But who's going to pay? because a lot of the victims of addiction, a lot of the individuals that are suffering from mental, neurological, substance use conditions, they're not able to pay. And so that one now will fall back on the government because people then go on let governments pay there now for take care. But I believe as a country, if we build the capacity, first time you didn't have the experts in the country. You have the experts now. You have me, you have Ansu, you have Dr. Jallo, you have Dr. Elizabeth. You have people that are trained and they're subject matter experts in our own expertise to do different things. Again, where they build us, not to plumber no more, they build the us. You need all hands on deck so that we come together and work to build the system of care.
Also, in communities that will not go so, like say McKinney, I've been to Gaza, I meet with the guy and I'm in place out of union and support we they get from people and be able to set up that place and get some young people in there. How una they collaborate with people like they already don't provide services outside government run rehab centers and up in there?
Yeah, I think that is connected to the regulation we talk about in terms of what took in place as a country. Well, interestingly, through the Ministry of Social Welfare, government enacts a professional social work regulatory bill where you get for the regulator agencies, and people that are providing services in the every social workers. If I'm not social workers, then therefore begin to get license. If you don't get license, you're not trained and qualify and register with the regulatory council. You know, we call it a social worker. Because now they get for the register that are part of the regulation. Also, I know say we get mental policy and strategic plan. We currently doing validation and review and that kind of thing there. But in terms of legislation, of course, Carol can be a witness. We still being small because the mental health bill is still somewhere. I think it's seated between the Ministry of Health and the law officers. But it's still not being enacted, the mental health bill, it in draft form. So in principle, the Lunacy Act of 1902 is to stick in this country. So we need for push that side, that's just the reality, So in that kind position, we can find that being difficult for regulate there. The informal centers, that's what I can call it, recently, just a few weeks ago, the Assistant Secretary General from the UN for Youth Affairs. He applauded Rehab Center. He visited PMTC.
And so now they call the guidance inside the service users.
They are service users. Yes. They applaud them, and we feel very proud of that day because they expect say when they go there, then they meet and they tie them and they beat them. Just like it happened at the center with the Tomboso. But these centers they take advantage of the gaps with it. That's the reality. Community people, then they go there. But we still try to see how we can reduce, the proliferation of the center in day, and I think one of the means where we can handle that now for establish more centers, because if we establish more centers around the countries, we can move them from the inside in there. Because there's a lot of inhuman treatment they go on there, a lot of human rights abuses they go on there. Because as the government rehab centers now, we get standard operating procedures, so we respect the dignity, we respect the human rights, and we ensure they will learn from which other countries that they do best practice.
Now the government run rehab centers. Waiting at the SOPs. Waiting that they go through. Say it's 3 weeks, right?
No, that's 2 months.
2 months. Waiting and they do inside that 2 month day.
That's 2 months. We get very rigorous routine. First of all, that make before they establish any center, we provide training, what we call multi-sectoral training for responders. That the one would provide services at the center. So at the centers, in the East Center, we get social workers with the work day. We get mental health practitioners with the work day. We get medical people that could work with Ministry of Health, the DHMTs them. Then the work day, of course, we get the security forces. They will also get drug addiction specialists them with the work day from National Drug Law Enforcement Agency. So it's a multi-sectoral approach where the model we use, we call them biopsychosocial model, and we'll also use community-based rehabilitation model. We'll learn from other countries. So it is very standard. We get rules and regulations. And I mean, we go to a rehab center. And that means that because you're a victim, you go do any kind of you feel. No. We get disciplinary measures.
And so German and they watch over them.
And that's what German then. That's how we train them. Yes, that's how we train them.
Well, they drill them. Do they go to
they do exercise. Morning first. They'll get home mothers and home fathers. Because we also, respond to the spiritual aspect. Some people they don't believe say this thing is spiritual. So they prayed it a lot. In fact, some say when they come on rehab, they don't turn to born again already. Either Muslim born again or Christian born again. So every morning, then they exercise, then they eat them breakfast. Of course, they feed you not enough for talk. Before they come on the rehab center, all my enjoy the big, all my belly the big, because they feed them very well 3 times every day. Social workers, they provide counseling sessions, other psychosocial interventions. Even the families, we get limitations as part of our SOPs. Families, they don't know where they go visit to. No, until towards the end of the rehab, with families that can begin visits, so can get a family therapy. Because on Monday, they don't get serious issues in family. So can ensure to try to create a cordial relationship. So then they play football, then they dance it, then they chill it, then they really get good time. Then above all, we confine them. You know, they go any side. So they don't get access to drugs and security is tight.
I asked earlier about the existing, centers in our communities. There's some way on our aware of. While soon they create rehab centers, say like in Kono and in McKinney, how na they get them people now from the registered numbers you already get now na the kegwa na they work with them. Could they be providing people say okay we get this number then self can go now na rehab center?
Yes, well, we register. We register because we get an assessment system we use. We register, so we work with that data there. But however, like McKinney, so that center, I don't want to call the guy name. I don't try for create a relationship between and the staff there they under for very very closely. But because these are the first batch, we'll not be able to take anybody from in center because we don't already get a list, an assessment list where would they use. But the hopes in future, if we expand our facility there, don't do that in center, we can move them, and assess them and ensure say they're able fit for going to the rehab center. So they try for work on anything in there.
Doc, I will ask you about rehabilitation in communities, reintegration, to say, after the rehab centers. We get some people that can get relapse, it's difficult for them to come back now in communities, stigmatization and all of that. In cases where family then gets people them where they don't get situation with, or then still they get issue with them picking them, how do they handle the situation then they for help them people there? We don't come on at the rehabilitation center, let them not go back to the bad thing that with them in deeper.
Just like Ansu say, it starts with the therapy, the family group therapy before they left the rehabilitation centers. But it's also inclusive of doing a lot of stigma reduction. And that's really a lot of the education side, the psychoeducation for the families and for the community. And even for the individual themselves. Because even when they come out and post go say, hey, then they drink, then they go smoke, how then they handle that pressure? Again, we're talking about reducing relapse rates. And so it's really when someone's going through rehabilitation, you're going through a period of change. And so it's about reducing the urges in the brain. Because if someone has an addiction, if they're a victim of addiction, small stress no more, it'll send a signal to the brain, la smoke, la drink, la do whatever the addiction is, la gamble, because not just drugs that we're addicted to in this country, but is how do you retrain your brain, and how do you deal with the pressures of life? Even if you day first world, though, there's pressures of life. So how do you deal with the stress of life? Aside from drinking, smoking, or whatever your vice is. And so it's a lot of education that needs to take place for the individual, the family, and the community.
Poverty and the environment gets any contribution to, issues of mental health and stress?
Well, I would say anywhere in the world, poverty, violence, the history of violence, these are some of the social determinants that we talk about of our mental health, things that are impacting our mental health and well-being, the state of our psychological well-being, even as a country. You would see that after the war, there was some psychosocial support, reintegration, but then at some point when the funding stopped, all the organizations went away. I believe there's just one organization that deals with survivors of sexual gender-based violence. And so it's really how do we build a system of care outside of the clinical system? Again, using a public health approach, using a population health approach at this point, because it's really it's an issue it's affecting our population. And so if you have a a woman, I talk about this all the time, epigenetics, woman then they born, picking them that's already been exposed to trauma. And so you have a whole generation again that has had their childhood interrupted. And you're now having these children that are having children. And so now we're actually just spreading the trauma. We have intergenerational traumas in families. We have domestic violence. There's so many issues that affect our determinants of our health here in Sierra Leone and abroad. Not to just Salon no more, they deal with poverty. Not to just Salon no more, they deal with violence. Not to Salon no more, they deal with at-risk situations. Even health situations. You have trauma that's impacting our health, impacts our physical health as well as our emotional health. And so we have to take a holistic look at things that have happened to us. When we talk about the rates of, say, diabetes, the rates of cancers, all of these, there's data to show that there's a correlation between these physical issues and mental health challenges, these physical issues and trauma. So how do we come together and build a system of care that talks and speaks to all of this? If you go to Kissy Hospital for treatment, where you come on a treatment, where's the link between Kissy and, say, your school or your college? For make sure, say, where you left that hospital today, you still go get the supports where you need, usai they go. So even with the system that they're building with the rehabilitation centers, just like Antu mentioned, they have the relationship with the Ministry of Youth, so they're able to talk to each other. There's records that can speak to the issues that are going on. They should be able to come back a year from now and say, oh, this person then goes so-and-so after they left rehabilitation. What's an update? Where are we now with them? And that's how you do the monitoring and monitoring and evaluation to see the effectiveness of the interventions. And if the data is good, solid data, you continue. If it's not, then you refocus. You reshift and refocus.
Who are the most vulnerable to mental health or whatever?
So I would say, according to WHO, over 1 billion people in the world live with an MNS, which is a mental, neurological, or substance use condition. Women are most vulnerable, especially when it comes to depression and anxiety. Women are most vulnerable, but individuals that live and have these adverse social determinants of health are most vulnerable. So the economy of a country, economy of Sierra Leone, the healthcare system, the social system, the education system, the workplace, all of these things have a role to play in our mental health and well-being. And so, again, at 65, where do we go from here in terms of expanding the work that has already begun? Where do we go from here to building the system that we need in terms of mental health care services across the country, and that's using a multi-sectoral approach?
So, Doc, what would you recommend? How do we build a system? You know, the system we don't talk about. So, college, schools, people are going to behave different way, but you need to get a system we go identify them and provide them with the support. You get students when not go show up for classes. When a brilliant student we don't show up, sometimes they begin, careless in course, but there's no system. How do we build then kind of system then there?
So we've actually started. We have a mental health and psychosocial technical working group, and so as part of it, most of the line ministries are part of it. I would say it's a subsection of the presidential task force, and we meet often. And what we're doing, we have a focal point from all of these ministries, and whether it's higher education, social welfare. So what we're doing, even youth, Ministry of Health has been invited. And so what it is, we have all sat, we've done the survey. It was the WHO survey. We did WHO did a regional survey, Afro region survey by MHPSS. We did that. Even with doing the guidelines, I drafted the guidelines and it was validated utilizing this multi-sectoral approach. And so the goal is to really build up that technical working group so that they can now integrate mental health into their specific workplaces, the ministries, directorates, and agencies. And that way you'll have a focal point at the ministry. The ministry, whether it's the college, if you have someone, a focal point at the college, where the lecturers can say, oh, this student isn't coming to class, or even where the students can go. I'll use the Colat Center as an example with Dr. Aisha. That's on campus where individuals can go and provide and get psychosocial support for what they're dealing with. Because we don't have the capacity to wait until people develop a mental health condition. None of the countries do. America is still dealing with the shortage of psychiatrists. And since we don't have that capacity, it's very important and crucial to build that buffer layer. And that's that first layer when we look at the pyramid of psychosocial support, the mental health pyramid. At the bottom is very basic services. Like just like me and you, they talk now. How am I equipped to talk to you? How am I equipped to provide maybe motivational interviewing to understand, not to for just talk to la mana osho bia ya na for bia. It goes deeper than that because we're talking about a brain disease, and I think that's where we miss the point. When we talk about mental health, when we talk about addiction, it's diseases of the brain. And so how are people going through that regeneration, retraining their brain? It's called neuroplasticity, right? And so it takes we have to develop the skills. We have to develop the workforce. And it's not just the health workforce. We have to develop a layer of individuals throughout the country that can support the mental health of individuals that are going through. People can just need somebody to talk to.
Yeah.
People then just need guidance. Because it's when you get something where they add to that bia. You just a cover no more. You just a cover. And again, just the example that I used earlier, like pot, you go braille over. But if there's an early intervention, because again, MHPSS was really designed to focus on prevention and early intervention. So if there's an early intervention buffer, and I come to you and I'm able to show you how to do problem management skills, how to identify how your emotions, your thoughts, feelings, and emotions, how to regulate your emotions. How do we deal with nervous system disruption? Because this entire country has been affected by trauma. Trauma impacts our nervous system. And so when you talk about that anger, that displaced or misplaced anger, people are dealing with dysregulated nervous systems. So how are they taught now? How do we regulate ourselves? How do we regulate our emotions and our behaviors?
The healthcare system as well, do we have the expertise or ways of identifying what could be mental health issues if somebody show up and how it could be handled?
Now, I know that at Kissy Hospital, they have staff at Kissy Hospitals, and then you also have mental health nurses that were trained by the Ministry of Health, I believe in 2002, not quote me, but I believe it was 2002.
Just feel free to talk.
Truth tell me, I believe it was in 2002. So they were trained, I believe, by King's College. So you have in the hospital and the government hospitals, and even with when you talk about perinatal mental health with the women, then where they go born and how do they deal with postpartum depression, how do they deal with various issues that come up during pregnancy. You have individuals that have been trained. The actual numbers, again, what I know is I believe it's just 3 psychiatrists now in the Kissy Hospital and 19 mental health nurses, but I stand corrected. And so we need to build up the system. And I know they're working, PIH, along with Kissy, the psychiatric hospital, they're training other doctors, specialized doctors. But we need more than, I'll say roughly, if there's 20 mental health professionals in Sierra Leone, we definitely need more. Again, because that still goes to less than one person for every 1 million people or so. I don't do the math. I don't say I
know. But also, as we try for conclude this conversation, waiting, communities, them people, them we get individuals, them we they want for see. Going to rehab centers. How could they get in touch with the ministry? How remote communities. We don't talk. The other day we get a reporter from Falaba where they talk about the Kush situation. They, I'm sure, we are not reaching them part in it. The northwest put local Cambia and all inside and they. We are not get rehabilitation center there, right?
Oh.
Yes, the areas in there. Waiting at the plan moving forward.
Quite interestingly, the Minister of Social Welfare get offices now every district by this country. Now the good thing down there. And all man for no say we want for we concerned by a person with the on addiction, take them to the Minister of Social Welfare office, may get them registered. In fact, that makes self, that data they will talk about, not only Freetown, but a national, because we don't encourage all the districts for register and be on standby. And also the rehab centers already established, for example, Gunama, now for the southern region. So people then from Pujang, Bonf, they get right for contact with offices them, for men and come within there. They already established now Daru, Kailan district, is not for the eastern region. But of course, coincidentally, we don't get Kono. So anybody we are concerned, may just take in person and go register them at the Minister of Social Welfare office or get every district, then go get her assessed, registered. Then when it's reach for there, we take the rehab. We'll do this.
Before that, when I get any support, when they provide, because I'd imagine if somebody gets in picking and you don't go register them and rehab not day, which kind of support when they provide before say when I establish a rehab center outside and go go place it?
Yeah, so let me get social workers now all of their locations and they initially they could provide psychosocial services them, they provide counseling sessions. We can call them for massage them. For calm them, because most drug addicts are not willing to for kind to rehab. So then they provide them counseling sessions and psychosocial interventions for ensure say then continue for pacify them, for encourage them, for the tell them small, but waiting it mean for go rehab. So it can really take with time. So when they reach now from any opportunity they come, we're not can find that difficult. So then services then they basically when they provide now then communities then they.
So who sign a next in line for open rehab?
Yeah, many money kind of more. Once the money say, I mean, for example, there was a gap in the northern region. So, the McKinney one, a very good move we don't make. With the hope say, once we don't get resources, we'll expand that day, So for now, at regional level first, then hopefully, with time, as we get more resources, we'll see how we'll begin target, districts then. But for now, on a regional level, with the target.
As the person I could say is this alarm about the rehab centers being closed and Usai with the president been visits, and set up a team, yes, and as well make some promises. What's in your general assessment about this whole issue of having our young people in the streets? I know we spoke about that, how been they sit in our streets, they move around. With your own assessment, it don't reduce around communities and major street na Freetown and other places?
Well, because, we don't increase the number of people and way, they go into rehab. Of course, we still get National Task Force on Drug and Substance Abuse. We get the 5 pillars them, where we hope they will continue for be functional. Like pillar 5, the law enforcement. We don't see some progress don't make. I mean, in terms of the other pillars them, we don't see some progress. But I think we'll still need for do more. We don't see people in the afraid now. Now then they go hide themselves, then they go and then slum areas and then corner there, for go take the drug. What things in that huge improvement. But I believe so the more we're able to clamp down on the suppliers, that supply chain day, we're seeing it for FED, for that supply chain day, because even though young people go through rehab, but after rehab they go back to those communities.
Yeah.
So still here for reinforce, law enforcement for ensure say the one way they supply the drugs, cut that chain off. May all the pillars then continue to be functional because it's about awareness raising, because as we go into the fight, more issues than emerge. For example, don't begin get very young kids, as young as 13 years old, when they go into rehab, primary school picking take drugs. That's very concerning.
Wow, we don't get that level of
13 years. Yes, we don't get 13 years. Then also quite interestingly, if it's about poverty or unemployment, we don't get bankers where they don't sack, we don't go through rehab, we don't get solicitors, barristers. This last one get policeman, we be in a rehab with you. So it really cuts across. So we need to do a lot of awareness raising still. We still need to do a lot of community engagement for people that know say yes, they get role. The communities, the families, the family structures, right? Because some of the information they will get, poor parenting, it'll make young people in the jump in the streets, they go take drugs, picking them. Caribbean just about domestic abuse in our families. We don't see how drug addiction don't lead to violence in families. One man will just go through rehab, young woman in the late 20s. If they sell the drug, the day we taste some. A juvenile street 3 years, he left the 3 picking out him, man. Money they sell matter pencil for go, daddy they sell matter pencil for go buy drug. Picking they miss them parents there. So the family structures, poor parenting, a big issue. So in fact, I would like to tell you about the family commemoration of World Family Day in May, where the Ministry of Social Welfare the host for the very first time where they commemorate World Family Day. And these are some of the issues that we're going to discuss. You go really find me, you be part of it.
Definitely.
We even get a family health walk, on the 16th of May. Go find me because we want to talk about family issues and how families.
It's important. The breakdown in structure. But you mentioned something very critical. The age gaps. There's small picking woman, old people. How na they handle them inside there? Waiting na the different things them within they do.
Yes, and that make we get social workers. Yeah, where of course part of our SOPs. We get safeguarding principles where we deliver. We get child protection experts them with social workers in training. For ensure say just like how they do na correctional services. You get side for picking it, so that it can be very very challenging. Of course, we're in a situation where, Bella woman and SSF, turning a rehab, we don't realize they get belly. So lots of things they already handle. Now that make
but then they are parts, right?
Yeah, I mean, definitely. For example, like the females and the males, they separate them, obviously. They would consider the Asian day. Because, where the young man, begin they recover from the addiction, brother, they come and bad. So we can get them challenges in there. But these are safeguarding issues where can be part of, the management training, we can do for the social workers and be aware of some of the NT also. So there's a lot of dynamics where they happen. Especially where you get older people, you get picking and all that kind of thing. You get adolescents. So there's a lot going on, But the more in future, I believe say this one really need to continue. Because for example, Carol they talk about, women are the most vulnerable. And at the same, in drug addiction. Because all these numbers they talk so, women ain't show up for various reasons. But they are equally affected. In fact, the more vulnerable self to the sexual and gender-based violence, In fact, women in addiction, within in a rehab, they never even, see them period. So they affect their reproductive health. We have seen all of that. So, if we get money, we can even get, services we're not for just women anymore.
Yeah.
That's not here in this country. Or man for go one side, or go for separate.
Picking them only go one side,
woman all over side. So the dynamics is a lot.
And so waiting will be your message to parent them, families them. They want the way they on the waiting list, and they want them way maybe them picking them family members and don't go through the process and don't go back na the community they try for reintegrate.
We mention this all the time. Parents them they need for support them picking them. They need for care for them picking them. And men not remind them picking of the past. Hey, where I change? Drug addicts, this drug business. No. We don't go through rehab. Men they respect the decision they don't take for changing their lives. And then therefore encourage them. Because, one of the challenges where we talk now just now. So we then go back now the communities, then therefore begin the first stigmatization. People anyway they stigmatize them. But this they change, they ever change. From that they police drug business. Parents and for left and day. The communities and for left and day. That make what they call the ambassadors of positive change. When they don't come on rehab, we don't work with them and make them believe in them because the young people they are the future leaders of this country.
Thank you so much, Hansu, and I want to say I appreciate that. A lot of people when me don't refer to you will come back and give me feedback, say yes, you've been responsive, and they listen to them and either register them, people them, then they are the waiting list. Someday we don't get admitted, and then picking and don't come out. So that's the best we could do: raise awareness and connect to now with the right people. So people don't they ask questions about the fight against Kush. I think we raise an alarm. Government take an action, president been visit, set up a task force, give directives, and you see the judiciary as well, and they report about cases and people who then they convict. Police, just over the weekend, I see them go funkia, then scatter their makeshift structure, and then slum areas, them outside and they sell drugs. It's still a challenge in our communities. We know the people, them influential people are involved, but we all get a role for play for continue for fight this. Because now we picking them, now we brother them, now we fumble them, we sister them, now then they get involved in them. So if we keep them and see people in the front riches and move around and bluff at the detriment of other people, and we know them and can't inform the police or move them out of the communities, then we're part of the problem. We all get a role for play. Doctor, I just want to ask a final question. Waiting people, waiting are the signs with family members, people in communities, study them for look at where a certain behavior pattern, where person they put up, where them for try for gam psychosocials or think say their mental health issue, the kind support with them for gam.
So I just want to back up and say mental health is not a bad thing. We all have mental health. Mental health is a state of our mind, and it operates on a spectrum. But in terms of looking for changes, is a decline in good mental health is changes in behavior, changes in habits. If somebody all of a sudden they begin sleep boku, or if not person way, then they sleep 1 hour, they don't wake, then there's those are some of the signs. Someone that eating habits. Sometimes they eat small, now that they eat boku, because a lot of times if someone's coming off of addiction, I'm going to catch them. And then also in behavior, how this person they behave. And I'll use the example of anger. If you get somebody where first not just calm, cool somebody, and all of a sudden they begin change now, then they vex, or they begin stealing. It's just really signs of changes of behaviors that you can notice. And then just have the conversations. We have to have these uncomfortable conversations, because we not go sit down, just wait, stay, and come. Now we're looking for a rehabilitation center, noticing these gradual changes, having discussions with each other. If now you picking, now you man, now you man, have the discussions. What did they happen with you? How you they feel? We like for tell we self morning. How they do, but it goes further than that. How you really they do, because if you ask somebody if they're okay, if you ask them 1 or 2 times, so they're gonna tell you, man, I know okay, and I so and so they go on. So just having these conversations with people and listening, and then also privacy. We get for land for keep we secrets then at this country.
Yeah.
Person not go come to you, then you say, Carol, it's in Carol they go through, because that's part of the stigma. Person they not go talk. And people then they suffer in this country. Honestly, people are suffering. Women are suffering. I get stories all the time. People come to me, and it's unfortunate because it's an issue that has permeated our society. We're seeing the residual effects of our traumatic past, and we need to handle it head on. If we're going to heal as a nation, healing starts, yes, we can have dialogue, but healing starts with when we're processing our emotions and learning that neuroplasticity to retrain our brain so that we're not as reactive as we can be in our society.
Especially for young people, youth picking them at home, them behavior pattern, waiting parent them for look out for, and pay attention to them.
Again, even with children, it's these changes. Now, there's mental health conditions, there's behavioral conditions, there's even children that are autistic, and so we don't want to label mental health as a bad thing. People can have a mental health disorder, behavioral disorder, emotional disorders as well, and still function in society. I mean, they read this morning one woman, she's schizophrenic. She's now a lawyer and a professor at a college. You say they be even America, they be the chain anytime she had her episodes, but she got past it. She's hearing thoughts, seeing things, but still moving past it, dealing with the situation, dealing with the crisis when it happens, but then still able to have a function in life. And so it's about observing, knowing, now you sabi you picking, now you sabi you man, now you sabi you woman. So knowing when things are changing. In terms of children, knowing what the stages of development should be. If picking by one, then they walk out, we don't tell what born enough, remember I guess. But if by that 1 year old, then they walk out, or whatever the case is, we should know that, so that you say if you picking out a creep, if you don't 6 months, they creep, or whatever the case is, knowing that this isn't, there's something that could be wrong. I don't like to use the word say it's not normal, because what's normal? None of us are the same, so you can't say you not go get a measuring stick on what normalcy is, but just observing change and things that should be happening that's not happening in the case of children. Some children may develop a reading disorder. That doesn't mean they have a mental health disorder. They may be dyslexic, and so that's why I think we just need more education, because we can just look at mental health in a box, and it doesn't fit in one box. It doesn't fit. Mental health works across a spectrum, and everyone has where they fit on the spectrum. And it's when you start to shift a downward spiral from where you are, that's when we need to take a look. And that's where we need to have these interventions that are proactive and early interventions, and not wait.
Is there any special attention or care for pregnant women and after then deliver?
Not that I'm aware of. Not that I'm aware of. But there should be. Because if you look at perinatal mental health, a lot of the times, even when you're talking about maternal child mortality, you have women that have children that go into psychosis afterwards. You have women that are going through depression before, during, and after. And women complete suicide. And suicide is another issue in this country that I don't believe we get enough attention. Because the last time we check, there's no status. I don't know if you know on the number of people that complete suicide. Because the data are not there. And so how do you address these issues? And this comes down with, if someone completes suicide, we didn't go to the mortuary, how are they categorizing it?
Yeah.
Because it was within this year that I reached out to the Kissy Hospital, and I was told there's no data on suicides. But it happens. We all
mental
know-
health can lead to that.
Exactly. It happens. And the silence. Suicide is driven by that silence about mental health, the stigma behind mental health. Person go, rather, before I tell you my secrets, I go complete suicide. And so these are some of the things when we're talking about harm reduction, and reducing suicide rates, and reducing suicidal ideation, and that's just the thoughts of wanting to complete suicide. It's all about increasing awareness, like Ansu said, but also accessibility and availability of care. Again, the basic care, when we're looking at the psychosocial pyramid, the basic care, which is really having these uncomfortable conversations and seeking interventions early. There's so many evidence-based interventions that we can teach people, train people, build their capacity. And I think these are some of the things that collectively we all are working on. But again, there's a lot of it's fragmented in our communities. People say, hey, ain't advisor enough for the train, but that's my specialty. My master's is in education. I have curriculum development training, and that's why I was brought on. I wasn't brought on to just sit. It's really to build the capacity, and we were able to do it in the first year, with training 1,090 people. So hopefully, and this is training people that can train other people, right? And you're utilizing the trainer approach. And so if we're able to expand on that, it's good for the country collectively.
Okay, thank you so much, Dr. Carol Libor. Thanks for the uncomfortable conversations. We should be having them within our families, communities for able to provide support with religious, with traditional leaders, them. We all go through a lot, if we don't have people we can confide in, people that we go listen to and help with address them challenges, and it will get worse, and like you say, get a lot of people they isolate themselves and they afraid for talk to people, then secrets all go out there, and hopefully we will get the right support and continue to do this and help with communities them and help people them for provide the right support. We'll take a quick break. We can talk to our next guest. I hope we don't get an insight of mental health issues and well-being, and also the efforts where government they make through the Ministry of Social Welfare for providing rehabilitation support to victims of substance abuse. It's tough. Challenges are still there. People are still there left out. But collectively, we will continue to ask the right questions, and also we self get responsibility in our communities. Them. Shall we possibly sell drugs? Expose them, because if no, you picking not take today, your brother and picking go take tomorrow. You picking say vulnerable, and it could be addicted, and it could be problem where you as a family person go be faced with. We'll take a quick break and come back shortly. Continue for stay with me.
Fellow Sierra Leoneans, let me now speak directly to the amazing young people of Sierra Leone. You remain the cornerstone of our society. I am aware of how the realities of our time affect you. The frustration of finishing school and not finding work quickly enough is real. The frustration of carrying ambition in an economy that has not yet created enough room for it is real. The temptation to believe that your future lies somewhere else is real. You deserve honesty from your government. You also deserve effort from your government. Everything we are building in agriculture, education, energy, enterprise, and skills will open wider pathways for you. The purpose of our policies is to improve the life opportunities of citizens. As government does its duty, I ask of you discipline, courage, and belief in your abilities. I ask you to reject drugs, substance abuse, and crime because Sierra Leone needs your strength whole, your judgment clear, and your talent fully alive. I also ask you to hold us accountable. Demand seriousness. Demand results. Demand a country that makes better use of your gifts. Sierra Leone needs your energy, your ideas, and your determination to demand more from this country. We are building with you, not for you, and not without you.
It's the song of Jama. Stories are born, legends are made. But to feel the heartbeat of this land, Salon Hidden Gems presents the song of Jama, a fusion of music, dance, drama, and tradition. Written by Dori Toure and directed by Bilal Jallo, aka BJ International. Join us for two spectacular performances, with the premiere happening on Friday, 1st May 2026 at 7 p.m. and the grand finale happening on Saturday, 6th June 2026 at 7 p.m. all happening at the prestigious Bintumani Auditorium, Aberdeen. Ticket prices: standard 200 millions, gold 400 millions, premium 600 millions, and VIP 1,500 millions. The stage is hungry, the drums thirst to be played. For more information and tickets, call 099 311 875. Brought to you by Salon Hidden Gems.
Are you tired of waiting in long lines at the bank? Say hello to Omnolite, your ultimate banking solution from EcoBank. With Omnolite, managing your finances has never been easier. Here's why. Omnolite allows you to enjoy easy access to your account information across multiple countries. Monitor your accounts in real time from the comfort of your home or office. Rest assured, with Omnolite, all your online transactions are guaranteed secure. Do you need to transfer funds? No problem. Whether it's domestic or international, Omnolite has got you covered. Make multiple payments effortlessly with our convenient multiple transfer service. And paying bills is a breeze with Quick Bill Pay. Plus, schedule future payments hassle-free with standing order. Want a checkbook? Just request it on Omnolite and it will be delivered to your doorstep within 10 working days. Experience the convenience and efficiency of Omnolite today. Visit us online or at your nearest EcoBank branch to learn more. A better way, a better Africa.
When starting your day, getting fit is the first step. When the hustle starts, nothing should stall you. When it's time to plan your future, saving should be easy. When you're ready to expand, no room for excuses. When your child needs relief, waiting isn't an option. And if it's you asking, no isn't an answer. Because for us, when it comes to banking, it's all about you.
Sierra Leoneans, at 65, a nation must also speak plainly about its democracy. Democracy requires a strong and active opposition. That is not in question. A healthy republic depends on contest, scrutiny, disagreement, and debate. But it also depends on presence, participation, and duty. When a person is elected to parliament, they hold that seat in trust for the people who stood in the heat and rain to put them there. When mayors or councillors accept office, they carry a continuing obligation to the community that chose them. That duty and trust do not pause or disappear in moments of political disagreement. The people must continue to be served. This government has acted within the law in all matters concerning our electoral institutions. We have done so carefully, constitutionally, and with full confidence in the integrity and capacity of those entrusted with helping to steward the democratic process. The further entrenchment of free, fair, and credible elections is a national objective, not a partisan one. It is an objective my government remains committed to. We remain equally committed to the agreement for national unity and to advancing electoral reforms through the tripartite steering committee. As we move towards 2028 general election, we must do so with seriousness, restraint, and good faith. For my government, the door to constructive dialogue is always open. But even as we engage in dialogue, the work of governance must continue. I'm encouraged by the return of elected officials to their duty, and I welcome that step in the interest of the nation. Thank you for affirming an important democratic principle. Political disagreement must never suspend public service. The citizens who elect us are the reason why institutions exist. They must remain at the center of our conduct, our decisions, and even our disagreements. Let us therefore continue to engage through lawful institutions with seriousness, restraint, and respect. This is how confidence is built. This is how the republic is strengthened.
Democracy, government of the people for the people. Democracy, democracy, democracy is the government of the people for the people. We no want no fighter. And we no want no dictator. We no want no hooligan. No Chuck Norris, no political demagogue. We no want them gangster. Yes, we no want no dictator. We no want no hooligan. No Chuck Norris, no political demagogue. What we want? Democracy.
Indeed, democracy, the government of the people, for the people, by the people. You just listen to President Bio, an excerpt of his address to the nation on Independence Day, talking about democracy, inclusivity, dialogue, you know. And that they keep democracy together. How much do we have conversation about things that we disagree on? And naturally, we not for agree on everything. If we agree on everything, then there is a problem. For disagree, democracy provides for that. But if we're able to sit down and talk about the disagreement, you know, and how do we move forward in the interest of the nation. So this morning, we can talk about the outcome. Remember some time ago, our host ambassador Keunaya and Fatoma, when they talk about reimagining a just and resilient democracy na Salone, there was a multi-stakeholder dialogue with ECOSOCC and in partners them host na Freetown, where they look at waiting we for do, how do we reimagine democracy and make them more resilient in Salone, how we the people them would think say democracy they work for we from the grassroots level up to national level. So this morning I got my good friend and brother Mahmoud Kamara, we now founder and director of Reform Initiatives, and the Reform Initiative now one of the organization that we support this stakeholder multi-stakeholder dialogue na Freetown, and it was very interesting. I was at the closing of the event, and we get for moderate one panel asking question, and it was very informative. At one point I be asked if they invite religious leaders, until I see the woman from Council of Churches make a statement. Good morning, Mahmoud, and welcome.
Thank you very much, Lama, and good morning, viewers and listeners. I'm glad for being at the studio today.
So we can talk about the multi-stakeholder conference and dialogue we happen, but I want to talk a bit about Reform Initiative and the work we they do. I don't see work. We don't publish stories about reparation.
Exactly.
I don't host the British High Commission and I ask them about the request for reparations and saying they're fully in support of that and think it will happen. Waiting at the Walkway Reform Initiative, they do about. We talk about reform right now. Reform now one of the word them way so clearly in our politics. Yeah.
Exactly. Well, thank you very much for that, Lama, and thank you again for getting me in at the studio. Reform Initiatives na a Pan-African organization. We registered in Ghana. We headquarters in Ghana today, as you know, na Ghana base. We also registered in Sierra Leone. We registered in the US. We do work primarily for advanced reform processes for change the way systems in the work. And we get three areas that we will focus. One are reparations, as you mentioned. We call them reparatory justice because we look at the full spectrum of repair. We want for ensure, say, the historical crimes the way they commit, other people then commit against black people them. We correct them, their wrongs then they by repairing for them crimes then they. We believe, say, the transatlantic enslavement of Africans was a gravest crime against humanity. You recently talk about the UN General Assembly resolution we Ghana put forward, and Reform Initiatives now one of the organizations we work with the government of Ghana. In fact, we were part of the drafting committee. We draft that resolution there. So we work on reparatory justice, and as part of reparatory justice, we also get an element we call healing. Just this morning, I already talked to Dr. Carol Labor and the other colleague about psychosocial help and healing and welfare and support. Healing a very crucial element in the reparatory justice journey. Most of the time when people hear about reparations, they talk about financial compensation, but we get a full spectrum where they within the rights of international human rights to remedy. But
What
In
are we
addition,
asking for?
We dey ask for plenty things.
Is it what
So,
was taken away
firstly,
from us for comeback, or then for financially compensatory?
all of it? We dey talk about the complete repair and correction for the wrongs the way that we don't do. For like we rebalance the world. The way the world is right now as a direct result, and this is proven, direct result of that first transaction. The foundational crime of the current world where we live, now the enslavement of Africans, where other people then come, then see human beings like we, black man and woman, and they say, no, not fit for be human beings. Una for be property. Una for be chattelized, routine with man and call chattelized. The same with man and then give it a name then they, because they not see we as fit for be human beings. So they come, they not just take mortal man there, they also take plenty things with resources, then destroy and disconnect communities, disconnect human beings from their spiritual and ancestral homes. They do a lot of things we very serious, and we consider them as very heinous crime, as them bookman can say. But what we call for now for ensure say we get a rebalancing of the world. We see the reparatory justice process as a world remaking process. The world therefore be remade and repaired in a way that black man and white man see themselves as equal, or people of different shades of color see themselves as equal. The wealth where they don't create now the West. Now as a result of the extraction where they create, where they take naya, the things that we they take naya. So therefore bring them back.
But we dey ask for reparation, and we still dey in a system whereby African leaders, African countries are still tied to donor funds from the West. We're still tied to IMF, World Bank.
Correct.
We still highly depend. Extraction of minerals is exporting and produce, and we import. That's how it is. So
I would actually counter that, because as you say, Africa don't always be the site of extraction. We always now just descend out. Whether now we young man them, they go, it's a continuation of that same kind of process where we serve, we provide service for the rest of the world. And we they get the dividends of them service. And if not we diamond and they take, now we oil and go take, now we critical minerals and go take everything extractive. And you mentioned them international financial institutions, the way they don't create. The institutions then create them for maintaining the status quo.
And we are signatories to them. We're joining them. We're taking from
because
them.
of the way the world then don't set up the world. The same people that we colonize with, the same people that we carry out the enslavement of we ancestors, and the same people that set up the institutions. They're not set up for make them create equity. They're set up for make them maintain their own power, continue for extract and take from we, continue for subjugate the rest of the world, so that they will maintain their own status. Simple as that. So if you want to actually get repair, we have to change that entire process.
But how do we get self-realization from we leadership? How do we I get the former vice president of Liberia, Naya, the other day. Yes. She was saying this stretch gets a lot of rubber, right? Liberia, they produce. How do we import tire from Mexico, from other countries in the West, when we can have production?
Produce.
I watched the documentary of where the Queen Kanaya the other day in the 60s. We were, exporting iron ore and diamonds. Pepel was still there, and Pepel is still being used by these mining companies to export the minerals 65 years down the line.
I'll tell you. So the problem will not get issue with exporting as long as the exports they bring back dividend for the communities and the people. Now, what would they ask for in this reparations campaign? Now, a complete restructuring of the systems and structures where they make sure say even when people they produce their own goods, their own services, their own resources, they know they get the benefits, or the structures the way they out, where they keep the rest of the world, the majority of the world, as second class or whatever. We change the structures because remember the time when they set up the United Nations, the only people who set up no African country not be there, not so then set up for themselves. The World Bank and all of this, still the power imbalance is still there. So they ask, again, to go to your question about what we ask for. We ask for a rebalancing. Like, there's no reason why Africa, we get one of the largest voting bloc in the UN Ordinary Security Council, for instance. There's no reason why the World Bank and the IMF and others, the decisions in one country, they determine, for instance, who will become president of the World Bank. Yeah, and so what do we want now? Not just the money where they don't take, because if you look at the amount of money where they go in terms of illicit financial flows and debt servicing and all, some countries and they spend between 50 to 70% of their GDP on debt servicing. So also you go get the money for provide education and provide schools. Of course, we get issues, we get problems as Africans and as members of the global majority, where issues of leadership. You know, you don't talk about this.
Yeah, but that is actually
so people will always come to that. But that for me is waiting. We call whataboutism. Now, because the moment you ask for this and say, "But what about this?" It's a deflection, and it doesn't address the actual problem. This is a continuation. It's the results. You know, the bad leadership, the corruption. We're not trying to shift the blame here to colonialism and other things, but it's a systemic problem. They come from what we inherit as a country and as the systems that we inherit. They are all mostly colonial system. So we get for deconstruct the one in the force, change the leadership style, change the mentality. It's also key thing for we. One of my favorite Pan-Africanists now, Bantu Steve Biko. He say the greatest weapon of the oppressed of the oppressor is the mind of the oppressed. So we get to start from the mindset. We get to change a lot of mindsets in terms of how we interact with leadership, how we behave with where we get leadership, how we provide the services where people in need. So we can address a lot of these things.
That is what I want to ask. At this time, maybe they ask for reparation. So, and Ghana symbolically don't lead this, and African countries and votes. But do we have the right leadership, for push this at a global stage, at a point where even we own leaders there are signing up to these things where we all agree, say it's not right. Maybe accepting these loans and not asking the right question against the colonial masters. Do we have the right leadership for able to achieve this?
We go get the right leadership. Remember, we don't start the idea of calling for reparation. New. You don't start from the very onset of the transaction. Although we know we're not calling transaction, because transaction are way two people they agree for share stuff. But from the very onset, people are not litigate against these crimes and these activities of enslavement, these activities of colonial plunder and extraction. We don't get leaders. We don't get leaders like Lumumba. We didn't kill them. Huh? We all know. Just recently, I was in Geneva, and we have been there with the granddaughter of Patrice Lumumba. We don't take one of the only surviving members from Belgium when the people will be involved in the killing of his grandpa. We don't take the case to court. We get the lawyers who they work with them. But most of the leaders, if you go back in history, most of the leaders will challenge. We want for ensure say Africa resources remain in Africa for Africans. They either eliminate them through coups or then assassinate them. So right now people are afraid. So if you ask me about the question on whether we get the right leaders, I will say yes, the leaders will emerge when the systems, right? When the systems especially the global structure, they're in place. Right now, a lot of the people are afraid. So which is why civil society, Reform Initiatives now one of the organizations, Pan-African Lawyers Union, African Futures Lab, different organizations, they collaborate with African Union and African Union ECOSOCC for ensure so we advance this agenda, because it's not going to be just one leader. It has to be a collective. The leaders and get the support of them people. So they push for ensure say we get that kind of leadership.
But how do we get leaders them? I was asking about self-realization. Lumumba and Nkrumah, they all talk about this African unity. That was the idea. How do we travel easily? Recently, we just see xenophobic attack in South Africa. For travel even at this region, no problem. Other African countries, you need visa, you go for wait stay before they approve you. How do we get that self-realization? Say, collectively, let me address your problem first. Then all them people are accountable for the problem when they don't cause power.
Well, it's not an either or. Actually, it's both and. We can still make the demands while we do in-house. The problems and they all side. Yeah, the problems even in Europe, they get problems with migration, they get problems with xenophobia and other things, and the division within. Then we know we of course as Africans we also get for fix we house in order. We always see within the very unfortunate things the way they happen in South Africa and other countries, and some of we don't raise these issues at the African Union level, at different other continental level. So we get for collapse the borders in Africa. There's no reason why I want for go Mauritius, I get for use other passports, or I get for apply and whatever. The other day, I somebody they talk. Would they complain about the Salon passports? How not to all countries we do they jokingly say, and to me on the Ghana now, I'll go probably find Ghanaian passport because the Ghanaian passports get a lot of exemptions, right? We don't need that for the continent, but we get leaders that we push for this, and of course there's always a divide and conquer a strategy where the colonial criminals, as I call them, always they use for divide and conquer. It don't always they work because we also get we own problems, and the problem now the mindsets, which is why I go back to Bantu Steve Biko in position that as Africans, as citizens of the globally oppressed part of the world, we get for ensure say we not allow the oppressor for use we minds, because at the starts the way we educate the kind exposure we get, the kind enlightenment, the kind interaction, the kind way we even think about we self as Africans, so as black people, it's all conditioned on a particular system and a particular mindset where they don't plant and we don't so ingrained that we are not even conscious of it, right?
The issue of transitional justice, it comes back to people saying we're blaming the West for we own predicament as well. African people were involved in the slave trade. If you say chief, then they will be in the cell. People, but again, 65 years down the line, where do we start in taking responsibility? Saying, we should hold ourselves accountable and responsible, because for us, people like us, a country like ours, we don't get democracy after the war, and we still complain about the things we've been complaining about.
So I'm glad the way you mentioned the transitional justice element, because then the other elements of we work at reform initiatives. You know, we do reparatory justice, we do transitional justice, we do work on democracy and governance. Now, just because we call for repair now and focusing on the contemporary issues, no means say we not for talk about the historical issues, because everything gets history, everything gets a foundation. So we argument that the foundational crimes, the foundational injustices, the foundational wrongs, now them lead to all of what we experience so today. Yeah. The war in Salon not just start overnight, not just start on the 31st or whatever, 23rd of March in 1991 with the guns. It take a lot of issues prior to that war. I write one article a long time ago where I say Sierra Leone are a wounded nation, and that wound start from the force place where we people them, people them enslaved with people them, then come back. There was no sort of healing, there was no sort of recollection. History is very important for we present. For we in this campaign, we're not just, it's not nostalgia. We're not just going back for where we go say, oh, they want to go back and try to get money for things that they don't commit 400 years ago. No, it's because the thing that they commit 400 years ago gets consequences today. We still suffer from the consequences. So it's all parts of a long journey of injustice. So you cannot, in Ghana, as part of the Adinkra symbols, they get what they call Sankofa. If you want to go forward, you get to look back. It's not just about going back to the things the way they do wrong. We can also look at things the way work. And we can also look at how we people resist. We all know about Shengbe Pierre, not so how Shengbe Pierre resists the enslavement among in and on the ship. So we not just don't make a blanket accusations about people and be involved. They also sell. No, and this is why for we get the 6 R's in this reparations campaign. The first one now for reconnect. what in the colonial criminals and the perpetrators of these historical crimes do now for disconnect we from the land and culture, disconnect we from the people, and disconnect we from we indigenous knowledge, disconnect Salon people away there, so Salon people away the other parts of the world. We want to reconnect that. Reconnect with we processes where they ensure say we respect we land, we environment, with the climate and all of those things. The second thing is for re-educate, because this question we ask now we get plenty time, but we people also be involved. But that's a result of the education we don't receive, because the education we don't give, the education we make sure say they erase we own history, they erase we the fight where we people fight against these crimes, they erase the resistance of we people and they also demonize the people that we try for ensure say African history, African culture, African intellectualism be elevated and amplified. So what we try to do is for re-educate with minds, re-educate with young people, and so that they not just go up and the only thing on that old people also be involved in the enslavement of our ancestors.
And in October, I think in October you were at the United Nations.
Correct.
And then you call for a bold call to replace traditional human rights education with reparatory justice education, arguing that time has come to confront historical wrongs with truth, healing, and systemic reform. But how do we domesticate that as well?
It has been done in a number of countries already.
Yeah, with us specifically, say
Yes.
Salon.
Yes.
How do we?
Okay.
Yesterday, I've been the exercise and I listened to Vicky Remo. I've been even something for listening about Salon history. I listened to Vicky Remo making Salon famous. And Joseph Kaifala, we are talking about the work with Joseph Kaifala they do.
Yes, I'm a main man.
Yes, exactly. Gojo, and he was talking about transitional justice and the support we get from your organization, but as well. How much do we, the education, how much have we been able for educate we self about what we went through with the war? The TRC report, how many of we know what's inside the TRC report and the recommendations? How do we get that at we own way of holding ourselves accountable and learning from our past?
Really, really good question, Lama, because as you know, Goju, now one of me main man then at this country way, they do a fantastic job. And so when we support the Center for Memory and Reparations, that 10-day Amide, the Africa Transitional Justice Legacy Fund, ATGLF as the director, and we give small grants to organizations there. One of the things where I realize when Abide do that work there, now the fact say we don't know about we self, we don't know about what happened, and we don't know the instruments and the mechanisms we get for ensure say we not repeat what happened during the war and even before that. So Gojo and others, they do a lot of work already for educate people. We also give money to, at the time, ATGL gave money to MRCG, Dr. Sowa and others, for ensure say we use the media for educate people there. Another organization where we still work with, in this case now at Reform Initiatives, now Fambul Talk International, John Cocker. And I remember you began John Cocker now after they declare in January 18 as Remembrance Day, because God will be done the advocate for this for a long time. So we get a responsibility. It's not the fact that people are not the Salon where we will do that work day. People in day, but it requires a lot of sustained efforts. It requires a lot of collective action, and I'm glad the way at least we now get civic education, because it requires a lot of civic education. Transitional justice, a lot of people see them as one-off. Oh, you come, you do this, you do TRC, and then everybody move on. But no, your transitional justice don't evolve. It don't evolve in a way that we do transitional justice not just as to deal with the wrongs of the past, but also for be preventative, for prevent a recurrence of the wrongs that will happen, and also help for be futuristic. In fact, one of the key things with reparative justice is it's not just about demanding for the correction of the wrongs of the past, but also for repairing a future that is equitable, that is dignified for everybody. So it's quite futuristic in its outlook and approach. So we get a responsibility, even though a few people they do the work. Like I had mentioned, Center for Memory and Reparations. We now get the Civil War Museum.
Yeah.
The other day I be there with Gojo, and they tell me about the Civil War. We also get the Peace Museum. We get different things that we the TRCB recommend. We don't do it. We are sure say the government they try for do small, but we have a lot of work to do. The schools, we forget. Not peace education or peace studies, not just at FBC.
University, yeah.
It can be from secondary school.
Yeah.
Because a lot of people don't know what we go through in this country. So education is very key, not just for enlightenment, not just for civic action, but also for the prevention of atrocities and for ensuring we get a society where everybody, like what they get now. Rwanda, people always make Rwanda. But if you go Latin America, it's the same thing. People talk about the dictatorships during the military regimes, and we want to do that across the continent. We work at reform initiatives. We work with different institutions in the Gambia, countries where they go through transitional justice processes.
Okay.
So we do that in Salone as well, which is why I registered the organization in Salone for work with various partners. Them where they already do this work for ensure so we continue. Education is really key for this work.
Finally, on reparation, one of the like should I say backlash or comment them Kemi, the leader of the UK Conservative Party, she's of African descent from Nigeria, don't strongly oppose the call for slavery reparation. He labeled them as a scam and they urge against paying for historical crimes. They urge the UK government, he said, enough of pay compensation. As people, she's of African descent. She's like us. Is there any backlash globally or from people like her saying, no, this should not happen, it's a scam?
There's a lot of backlash. And most of the time, the unfortunate thing that they use people of we kind skin color or we come from this part of the world for saying the kind of dirty message that we don't come out. This not to the first time we're going to get a backlash. The first Pan-African Congress in 1900, where W.B. Du Bois and others organized in Manchester, the Manchester Conference in 1945, we progressively lead to some of the independence struggle and movements. Every time where we talk about reparatory justice or reparations, there is a backlash. In August 2022, we organized the first summit. We call them Accra summits. We call them Advancing Justice and Racial Healing. When the former president, Nana Akufo-Addo, go in keynote, the moments they post the statements on Twitter at the time, you see the backlash. All man, so you don't come bring the money for loan and corruption, all kind accusation, right? Because people always think say when they say reparation and money, and when the money can to government to go, and when you go to government they eat her. But that is the problem with lack of education and ignorance. And people like Kemi Badenoch and others, I think I feel pity for Kemi Badenoch because now it's like I say, they don't implant a particular mindset from small. So the education, the interaction, the exposure, and some are also now opportunists, now political opportunists. They say things for
please the base.
For please the particular audience. Already in million they fail in a lot of in political polls. The polls are not the favor. So they want to do everything at the extreme level for satisfy a particular category of voters in the UK. So for we know say the position of the UK and other countries not go change overnight, and we're ready for engage with various member states across the world for educate them, because I think a lot of them know, but they are refusing to understand and accept. But we'll continue you mentioned dialogue at the start. We'll continue for dialogue, because this campaign is not a log frame campaign. It is a lifelong campaign.
Okay. And for Salone, waiting are we position on this?
Yeah, so Salone votes in one of the 123 member states that we vote in favor of the resolution. Salone will be one of them. And we hope say that Salone will take beyond voting at the UN. Salone gets a very significant role for players. One of the probably one of the only countries and few countries now this continent, if not the world, where they fend for formerly enslaved people. They bring them Nyasu after the abolition and create what we then call the province of freedom. Most of the abolitionists then get roots. Naya, I mentioned Sengbepier earlier. So Salone for actually play a more significant role. I just feel say right now it's either a lack of understanding or lack of engagement or a lack of interest. But me want for use this opportunity for encourage the government of Salone for work with the various reps, whether at the AU or at the UN, for put more efforts on this issue of reparations and the reparative justice campaign. Ghana don't appoint a presidential special envoy on reparations. Other countries they consider do that. At Reform Initiatives, we are getting requests from different governments. The last time, about a month or so ago, I got a request from the government of Mauritius. We educate them about how they can be more involved and more engaged in this process. We get well-respected Sierra Leoneans across the world where don't they engage in this process. In fact, one of the people who will be at the drafting committee where we do this as Sierra Leonean, apart from, in addition to me. So we get a role for play. We get a lot of history. We get a lot of knowledge we can share and help the movement. So me want for use this opportunity for call on the government of Sierra Leone for take a more prominent role. Collaborate with the government of Ghana, collaborate with the different other governments and the AU for ensure so they continue for advance the reparative justice agenda. And AU ECOSOCC Dayton, right? And luckily for we get the Minister of Justice. We don't be in this space for long, and so we don't need convincing for them. I think we just need a much bigger political leadership for ensure Sierra Leone play a rightful place and role in this process.
No, can talk about the multi-stakeholder dialogue, but I want to watch this video quickly. You know, this one was your closing, you know, Nadai event. Let me just watch them. They will take them up from there.
Amid fear, liberty cannot bloom amid hate. Justice cannot take root amid rage. He said America, but I've transformed that to Sierra Leone. Sierra Leone must get to work. In the chill climate in which we live, we must go against the prevailing wind. We must dissent from the differences and indifferences. We must dissent from the apathy. We must dissent from the fear, the hatred, and the mistrust. We must dissent from a nation that has buried its head in the sand, waiting in vain for the needs of its poor, its elderly, and its sick to disappear and just be blown away. We must dissent from a government that has left its young without jobs, women without economic empowerment, its people without education or hope. We must dissent from poverty of vision and the absence of moral leadership. We must dissent because Sierra Leone can do better. Because Sierra Leone has a choice, or no other choice, but to do better. I want to wrap with that because it is, in my view, a summary of the conversations that we've had today. And I hope that as we continue this conversation across the continent, we must get Africa to work. Africa must do better because we have no other choice than to reimagine a just, active, inclusive, and resilient democracy for the continent. Thank you.
Well, that was you, the closing, and you know, talking about the kind of democracy, reimagining which kind of democracy we want for Salone and how could we make it resilient. So one of the things I find very interesting, that multi-stakeholder dialogue, the comment from the people, what they want and how they want for them.
Yes.
You know, how do we get to that point where democracy could work for the people and directly people are involved in decision making? You know, where they influence policies and government policies and programs. The statement will like the statement where you make so.
Well, thank you for that, Lama. And that statement then a quote from Thurgood Marshall, for them people that they follow American politics or read American history. Thurgood Marshall now one of the foremost or trailblazers when it comes to civil rights, and he, one of the principal voices for advancing justice, for advancing democracy. So I use that quote today because I just feel what he says then several years ago also apply with situation as Salone. For Reimagine democracy, it's funny because I don't like the word resilient. Yeah, one me party who holding a one group. Martin Michael, my favorite word.
Yeah,
resilient citizens. Martin Michael, resilient.
I'm sure I go enjoy your outfit today.
No man, no. But the word we use the word resilient there, and I know it's not my word, but we want for ensure say we move beyond being resilient. People, you hear that mommy we talk na the program on the day about how the kind of the body language, the vibes, the frustration with the communities, and how sometimes they feel disconnected.
Yeah.
So the way we want for Reimagine communities, again, this actually gets something to do with the repair and looking back internally, going to your earlier question about how we fix we house in order.
Yeah.
Because one way for Reimagine democracy now for reconnect the people with the process, for reconnect and ensure say the people that we will lead, we will put for lead we, accountable to we.
Yeah.
They're accessible to we, and they also not see the leadership position as a thing way for make them create this master servant kind of relationship, right? It is the responsibility for make them serve we. Now we try for bringing young people, and we see a lot of other organizations that do this already in Salone. Reimagining means doing things differently. Rethinking the ways that we would engage in our political and democratic processes, engaging with values that way and principles that way ensure say we with democratic institutions then strengthen, they're independent and they operate fairly. We ensure say the people them get them voice, citizens them voice them not just go to citizens where you want for get them votes, or you want for make them agree to a policy where you do, but you consult them in a way that is genuine, that is detailed, that is authentic, and that is procedural. Something that we could talk about consultation, but people are just going for them and tick the box no more. So what we did try to do with this particular program, this is the 2-year program where we did do alongside African Union ECOSOCC. So it's an ECOSOCC program. Reform Initiatives is only an implementing partner.
Yeah.
And as you know, ECOSOCC na the citizen voice, na the civil society organ of the African Union. And they want to ensure say citizens play an active role. So we engage artists, we engage the creative industry. We want to engage people where they do engage in democracy work differently in terms of not to just the usual suspects, not to just the usual process. Creativity, innovation in how they, for instance, if they want to make a law pass, how then go get them parliamentarians and for make that law they pass. If they want for talk to them parliamentarians and for a law where the parliament one pass where they not agree with, how then for engage with them parliamentarians in there or them political leaders in there. And we also want for bring people foresee democracy beyond the politics of it, but also engage with the economics of democracy. What does this mean? The economics of democracy mean we elevate economic justice as a very important element in the democratization process, right? Most of the time, we always focus on the civil and political rights issues. We know they focus on the social and cultural rights issues, or the economic, social, and cultural rights issues. And this particular program now for bridge that gap there, not for elevate one against the other, increase the voices of citizens, strengthen citizens' voices tomorrow we dey go na for Bay College. We get what we call the Students' Assembly. And we want for talk to the students let we get their understanding of what in democracy mean. And we get the African Union, we know the AU, they're very good for produce policies and instruments. They get one policy we they call the African Charter on Democracy.
We've been a signatory too.
Yes, we signed that in 2009, we ratify them. And it came into force in 2012. But still, one of the first countries, among the 39 countries that don't sign and ratify, and Salon they among.
Yeah.
But if you check, there's so many things what we need for ensure say the Salon people they understand, and not just Salon people in the government. But we were very pleased to get the two ministers on the program on Friday. Alpha Sise, Minister of Justice, and Minister Amara Kalon, Minister of Political Affairs, where they then go reaffirm government in commitment for advance the provisions in the Charter of Democracy, Elections and Governance. So the outcome of that event there was quite promising for we, and we know we can talk a lot as civil society activists. We always talk, but with this one, we want to ensure say beyond the talking, we're also doing things that are tangible, things that are concrete.
But again, what thing come out of that whole conversation is the gap between the government, the people, and who that get role for play within civil society.
Yes.
And waiting don't missing lately. We're very clear now that civil movement now with society.
Yes.
Some time ago we had civil society movements, say SLTU, the drivers union. Everybody they sit and everybody in interest now another person in interest. We've missed that, and the people are not clearly whether it's lack of trust or everybody get their new agenda and motive, but how dialogue and engagement like they help for strengthening civil society for play their new role between the government and the people.
Yes. So, me a staunch student of the Dialogue University headed by Professor Chooks. And I believe say dialogue na the lubricant for every societal engine. Now, they make society move from conflict to peace. Now, they make we move from dictatorship to democracy. Now, they make we move from agitation to progression. Now, if we no dialogue with ourselves, nobody no go understand what's our various problems, then, right? And you're right. When during the conversation, it's so obvious that people are disconnected. After that event, we go na Congo market. We get a community engagement in our Congo market. And when I begin talk na Congo market, I ask people what they understand by democracy, and they answer. And then I say democracy na government of the people, for the people, by the people. Yeah. Somebody heckle. Somebody na the ground say not a government for the people. Not to the not for we. So we don't see that kind of disconnection there. And which is why we appreciate a lot of other institutions that they come up for bridge that gap between governments and the people. We also appreciate the government's efforts for engage with the people through those town halls where the government organized through the Ministry of Information and Civic Education. We also see how some government officials they engage with people online, although some get question mark around that in terms of whether they gaslight people when they engage them, or you did try for dismiss them because you know feel say they up to you kind of intellectual standards. But we still get processes where we can utilize the platforms and where people can utilize for ensure say they make the case across. Just recently we joined Citizens Barrier. Now, when I say we, I mean reform initiatives. Join Citizens Barrier and other organizations then for make an information right to information access request for let we get the numbers and contact details of all the parliamentarians within our salon. And that process is still Citizens Barrier they lead that campaign they very effectively right now, because we in other countries we get access to you parliamentarian. In Ghana also are they actually get access to me parliamentarian anytime, even though me not to Ghanaian but because now they serve me constituency, and they make sure say anytime if something wrong, if lights go or whatever, if there's a problem in the area, if I call ECG no come, or if it persists or things happen way, they reach out. I have the contact, right? I don't need to go through a very long process for access the elected representative na my constituency. So na that kind of work then they civil society platforms and they do like Citizens Barrier and Campaign for Good Governance and other institutions will be from part of that coalition. We get other ways where we can bridge the gap. Of course, the town hall now one way. The media now other ways.
Yeah.
So and you did do a fantastic job here for bringing political actors, political leaders, and some of the elected or appointed representative for can talk to we and explain. You get demand here from NDLA, right? This morning for talk about the drug situation and what. So then all of these are different ways we can do it. And the citizens also not afraid for demand. I know it's not easy currently. The repercussions them for plenty people them very tough.
But at the point, how far have we moved as a country, you know, with democracy and making it more inclusive, like the president saying in an address to the nation, more participatory, more inclusive. Also, citizens then go believe and accept, say, yeah, I got responsibility for all who are ever in a power. Accountable, respectfully though, but hold them accountable and ask questions.
Yes. Well, so it's a mixed bag because in some places we don't improve, in other places we don't decline. The people in the field, the other day they get some discussion with somebody, and they mention say right now if you talk now so thing will happen to you, but you know it's you get some people where they talk. We still get people where they talk. We still get you, for instance, where they lead a lot of civic enlightenment and make demand. Would they see them? Even though some of you not in a salon, would they follow Truth Media? Would they follow Liberty TV and other stations? The way they hold the politicians and the elected representatives accountable. We also get ordinary people where they do that. Although you know they at that scale where you expect, because people are afraid. People are afraid for me to not go lock them up and then throw away the key. People are afraid they not go say something when and say, oh, this is not incitement.
Yeah.
And you get different ways now where they will use against you, whether it's a cyber crime, if you do it online, and in other places they will just arrest you if you say things. So it's quite a mixed bag, and I don't think we get one particular line where we say, okay, we don't make progress here, we don't make progress. Because in some cases, if you talk about the liberalization of the media, for instance, you get a lot of media outlets with the open. But does that translate into freedom of expression in that strict sense of the word? The question is no, because you get areas that we still need improvement. Yeah. If you look at ordinary citizens, we know I don't know what's the last time when we get assemblies, right, of people coming together and make demands for stuff, right? Because please not. Firstly, people then go for think, would that go protest for you, then go kill me, mama, and amigo left. You can interpret that in two ways. Firstly, that are people no need for protests. For protests, if you see what I mean. They don't need for protests for make them demand. They don't need for going to the streets for to a stone and stuff. They can do them by just staying home. In the southeast of Nigeria, one of the most potent weapon where the people they use now, that's the stay at home, right? But you know, this is not advocating for them kind and things and they, because you also get impact on the economy and the society. But there are different ways where people they show their resistance. We will not for lose sight of. There are different ways people they show their disgruntlement. We don't necessarily mean going to the streets and destroying properties. Yeah, so it's quite a mixed bag.
What thing come out of that dialogue? Now, you know, the second to last panel before we come, it was the disagreement between me and you, Bindi Renaissance. You know, Augustine was reminding us how some long years ago, Renaissance may file a case that the Supreme Court questioning the issue of allowing people to protest, and now that's still not a case with the lawyer, and there is nothing on them. And this thing about, you know, people understanding their responsibility, but the space for later able protest or raise concern. And we are signatories to the
African Charter on
exactly where they provide for them thing and day. How do we get the political class, the politician, irrespective of who that in a power, and the security sector as well, for understand, say, this is a right. You're not doing people a favor. It's their right.
At all. You know, it's very interesting because what would they see? Augustine mentioned the shift in the Renaissance movement and the attempts by at the time of the court not for even handle that case. They see different other cases they manifested in different other cases, not just in Sierra Leone but in different parts of the world. As you know, Lamana, I don't work in different African countries there. I don't see the playbook.
Yeah.
I was in Nigeria for a long time, and I see how they use the same style, either for suppress and silence opposition or dissenting voices, or for intimidate you to the extent that you no go get, or for discredit your credibility and stuff. Of course, you get individuals and institutions where you don't need government for discredit them; they're already self-discredited.
Yeah.
But waiting at the problem now, where you not create the enabling environments. Again, this is one phrase we always use, right? Create the enabling environment.
Yeah.
So for create the enabling environment means, say, when somebody take case in a court, you try that case there. You give a fair trial. You assign the case to a judge or a magistrate for make the person get a say in court. Or if somebody say something where you not agree with, you disagree. You don't need to go jail and extended period of time because you disagree with them. Disagreements are part of the ingredients of democracy.
Yeah.
And they find out, say, across the continent, including in Sierra Leone, the space for disagreements it is small. It gets smaller as we progress, and it's not fair. It's not fair on the people. It's not fair on the state itself.
Yeah.
Because if you collapse that world, you collapse that space, where you go get a different view. It means now one side you go. You know they get a mixed reaction or mixed perspective. We go help you for govern the people well. So it is actually they're doing themselves a disservice by shutting down the space or by shrinking the space, because the space is not shut down, but it's so small and it's so clouded by fear that even people who get ideas, people who get different opinions, not the mind for express them. So people that want who left the country, people that want go, all my want go. Yeah. And one of my favorite songs where you can play now, Wrong Side.
Wrong Side, yeah. Costco B.
Costco in song very, very. I relate to. I resonate with me because waiting they happen now wrong side life we they live if you not create the space where people then feel say they get the freedom because the dignity we call for, even in the reparation, the dignity we call for also include an ability to be able to say and live a dignified life in your own society, for able to say or express yourself in a dignified manner where they not go dehumanize you. You state not go dehumanize you. So in as much as on the one side the government they try for inform the people about what they do, the activities and stuff, they also need for create space where people then for disagree with them.
Like you say, you understand the playbook. You've seen it all. How does things change when you get a set of people who are in opposition believe that it's their right to demonstrate, it's their right to protest, it's the right of citizens to demonstrate and protest, but when they get political power, that becomes a challenge. It becomes a problem.
Yeah.
What changes?
I think now people power and money they reveal people in true character. Sometimes we lose sight of the fact, say, people are dishonest and disingenuous, and they only need an opportunity for show their true behavior where you give them power and money. Now, waiting can change insecurities. A lot of time people then just feel insecure. Say, if I not do this now, I go lost this power, I go lost this status, I go lost this privilege. And me threats now this possibility on this other side. Yeah? People see other people as threats to their privileges and their status. So that can also affect people, their mindset and thinking and the way they operate. And we it's not just a Sierra Leonean problem. When we talk about Sierra Leone and the problem of Sierra Leone that there's this constant cycle, the same people, the same party, the same individuals who them criticize and they can do worse. Right? And we get a responsibility as civil society for create that buffer And this is one of the things where these projects they try for promote. And as you rightly mentioned during the Friday conversation, they call now for let people and commit. You know, civic action, civic commitment for ensure say we not allow the division for continue this way. We not allow the politicians for use and misuse we and later dump, but for create a wall where for protect people their rights, protect citizens their rights, citizens their responsibility of course it go alongside the rights, and for ensure say when we talk about unity, freedom, and justice, the unity for cut across everywhere, not just tribal unity. It also involves political unity, societal unity, cohesion. We get our samai in that. We talk about social cohesion. So that's a key thing. Freedom. It's the middle word in our coat of arms, right? Freedom get for come here so with economic freedom, freedom of speech and expression, freedom of different other religion and other things, which means we get for manifest that. And the justice, one of the third points in the coat of arms, not just about judicial justice. I think my friend Leone Thompson mentioned this on I don't know if Nabi Liberty TV or AYV.
It was AYV,
yeah. Mentioned that when we talk about justice, not just focus on the justice in the court.
Yeah.
We also need to focus on economic justice. It's really important because justice here also mean environmental justice. We get for respect and protect our environment, and we mean the economic justice about we can joke about the bread and butter issues. Bread and butter issue is a justice issue. So we need to be faithful to them thing then they for ensure say people they benefits from this unity, freedom, and justice what they talk about. Across all sectors and spectrum of society.
One of the things where the Attorney General, Minister of Justice, Alpha Sisi say, let's just say it quickly, waiting he say. He say, democracy cannot be the responsibility of government alone.
Correct.
Civil society must hold us accountable. How dialogue or programs, project like they were, they help civil society for mobilize? Because what is very clear is everybody is on their own path. We don't get that kind of mass movement where civil society they speak with one voice, politicians they listen and act in the interest of the people. How the outcome of this? How will it help?
No, I was quite pleased and happy that the Honorable Minister Alpha Sisi mentioned that because he gets a background in civil society, right? He don't come out from the international justice space and human rights space, so you understand the importance of this. And we were also very pleased for getting Minister Amara Kalon for interact with the civil society community through that dialogue process. I think their dialogue processes are taking place. Like there is no shortage of dialogue in this country, and the government, as exemplified by the ministers, them presence. They are not one minister or two ministers, and different other government agencies them show up. Yeah, for me, I was quite pleased and impressed because it shows willingness. This is not just party business, but it also shows willingness on the part of governments to engage and dialogue with the citizen. And platforms then they, spaces then they, where the governments to do that. I think civil society will take advantage of that. Civil society will come together. And there's a lot of faction, there's a lot of siloed working. Everybody want to take control of a particular space, or want to take credit for what they do. Collective credit is the best credit for civil action. Collective credit and collective action is the most impactful way for engage and get results for the people, because you are, at the end of it, you are doing this for the civil society, for the society. If we, as civil society, take the whole of society approach, we not go always the focus on, okay, if I do this, I will be in the good books of government, or if I do this, I will be in the good books of the donor. We need to look at it holistically for ensure, say, any progress will we make in dialoguing with governments, in engaging with government agencies, in making demands. If the results come positively, that result we all, they say, we all go take claim and say success gets many parents them and fumble, but failure na often. So if we take that approach of the communal approach to civic action, it will be really important for we as civil society, and governments go continue for engage. So we want for appreciate, especially the few government officials, them and government ministries and agencies. On that day, on Friday, we get the owners, we get PPRC, we get different institutions from government. We go then take the time for explain the process. We get Sludge, Manika, we also did it. We explain for clarify some of the misgivings as well about Sludge and the interactions and engagement with government. So that for continue. And as part of this program, through the leadership of AU ECOSOCC, we dey continue for promote these dialogic processes. We dey continue for engage different and new individuals and institutions. Like I said, part of this program, we get what we call the Creative Democracy Lab.
Okay.
Where we want to work with the creative industry across Africa for use new ways for engage and promote democracy strengthening and for reimagine democracy, as we say. We also get the Democracy Innovation Cafe, where it get to be based in Ghana and Zambia, where we use and work with young people, come up with new ideas for how we will engage political leaders, political actors, for that we be creative and innovative in advancing democracy as well.
We get our mutual view. They say democracy should not be one man, one vote. Actually, they say no. You forget a group of people.
Before you continue, I disagree with that.
So how do we imagine democracy? With what you see now, even we on region, democracy seems to be under threat, problematic, and then the insecurity and get military people where they can. I would say no, we should lead and all that. How do we get countries like we win an example successively? We don't get opposition win, hand over peacefully to the ruling government, hand over to the opposition. We get President Bill, he's chair of ECOWAS presently. How do we use our own model? How do we get politicians, both in the opposition and in government, for commit, say this democracy, we go reimagine them and strengthen them, so that man na Congo Tongo believe say democracy indeed is government of the people and for the people. How do we do that?
And I think we not get a one size fits all solution. Actually, that's one of the reasons why we big all that dialogue day, for come up with range of solutions, right? Now the reason why we also do go for big college tomorrow morning for engage students them, because sometimes we not engage with young people them in a way for bring out the solutions from them. The solutions are there, Lama. We just need to create the platforms and the spaces for give people them the opportunity for offer them solution there. So this program actually they seek for address this question where you ask me, because me not get the answer. The answer they come out from the people. The people will go tell we say if you want for change or rethink or reform the way we democracy they operate, not just in Salon but across the continent. Now A, B, and C you need for do, and then solutions and then we will collate them and share with government and other intergovernmental organizations. Reform initiatives, we get very good working relationship with a lot of the government who would work. I tell you, say, recently we get a request from the government of Mauritius. We work very closely with the government of Ghana and different other African governments across the continent. Yeah, so we collect these ideas and solutions from people, share them with government officials, especially ministries, departments, and agencies where get relation with the political transformation of the country. So once we do this, once we collect whether it's through artistic work, whether it's through development of technological materials or tools, or if na idea from the Mamiwe Common and Moriba community, we talk, and all these we put them together, present them in different forms. We also meet with government officials after this dialogue for ensure say, okay, this nine come out of this conversation, this now waiting the people and say. When we present her, we follow up. Just because we engage with governments, peacefully, amicably, and in a dialogic way, no means we no go hold them accountable as well, where things go wrong. And as I mentioned, this is an ECOSOCC process. Now ECOSOCC they lead this process because ECOSOCC is part of the African Union mechanisms, right? An organ of the African Union. So then go talk to members. Say they also go talk to the intergovernmental institutions at the AU level in Addis. So we roll now for collect, collate, and transmit. Collect the ideas and solutions, collate them, and then transmit them to the right institutions and individuals who get the responsibility. At the end of the day, it comes down to three things. 1, leadership. 2, leadership. 3, leadership.
Now you go address people.
Now you go change we can. Because and the leadership can come from different levels, not just from political leaders.
Yeah.
We're talking about community leaders. We're talking about people who decide, say, I want to know me MP. I want for get me MP contact. The fact that you take pen and paper, write to leadership action, and you don't take so for your community. So the leadership cuts across, and we want for ensure, say, people exemplify the leadership in different ways, in a more responsible, responsive, and non-violent ways, for ensure so they hold the government accountable. And then from the political appointees and appointed leaders, we expect them for also demonstrate the leadership we expect them for.
Finally, Mahmoud, kind of ring this bell. I can say this country, we all get a role for play, for move and go forward. And I can always say power belongs to us.
Yes.
Now the leadership we say so we provide on a community level.
Yes.
Civic space and private sector. But as well now we the votes, now we the sing and dance and turnover. Yes. So what thing will be your message? So mostly young people, young Sierra Leoneans, they participate in with democracy and governance.
Yes.
Are you going to ring the bell and just leave away with the message?
All right. Thank you very much, Lama. This now. The iconic bell ringing tradition at Truth Media. So for me, I think young people will not get for educate on yourself. Education is very key because, and I don't talk about school education no more. I talk about civic education and different forms of education. For make sure, say you ask the right question, you hold your leaders and your community reps accountable. Huh? If you don't know your rights, you know go will claim them. So educate yourself about your rights and responsibilities. Educate yourself about your role in a society for make sure so you hold power to account. So that's the first message to the people them. Yeah. The second message now to we leaders them. Be responsive and be accountable. If people then get a different view to you, not because they don't like you, not because they want you do well. Yeah, and they want for let society also thrive under your leadership. If society thrive under your leadership, now you do get the credits. So my message not to the people them is educate yourself, take leadership position, and to the leaders be accountable and accept. Say not to alter you go say or do way right. Thank you very much.
Thank you so much, Mahmoud Kamara. Thanks for joining us this morning, and it has been a very good conversation on democracy, governance, and leadership as well. And leadership cuts across. Now we are tire base. If you're not chairman, then a leadership you provide. Now market, you're not cheerleading a leadership. Now in community, now the civic space, now leadership you provide. So let we all take responsibility as much as we all with political leaders them accountable and responsible. Go out there. Truth newspaper is out. We get interesting stories, and this morning I will just read through them. We banner headline. Now we have sufficient condoms in the country. Remember recently there was this report about prices of condom going up and challenges of the thing where they happen at the Middle East will go affect that. And also we get Chadi reports. There are conditions in police cells. Democracy is not a gift. AU ECOSOCC calls citizens to action. Now then story then they go get, you can go out from your vendor and get a copy of the Truth newspaper. Now they end the program this morning. Many thanks to our viewers and listeners for joining us this morning, and we guest them. We don't join this morning, including Mahmoud Kamara. We'll continue the conversation tomorrow, 6:30. We can start early, with conversation them and prayer, the anthem and pledge and things same way they happen at the country. But as always, for God and country, serve your conscience, be honest with yourself, sincere, try for do waiting right, avoid waiting wrong, be a law-abiding citizen, because we all get a responsibility for move this country go before. The 2-9 they always last. So meet back to my name Namadu Lamgana. A special dedication to Mahmoud Kamara of the Play Alongside Life. Now they end with. Thanks for joining us and have a lovely day.
Respect to all Massive and crew. It's been a long time you've been away from home. That's why me come back. The way me sing things, go on, me bring you this conscious reggae vibes. Jah be my guide, Rastafari. Papa, you been tell we say, make we trust the process. But man, it is called the progress of the process. We are in suit and tie, and dirty character. Thief man, they all a thief now, this is them batter. I, Rasta man, me know Eric Cock and Bull, me represent green, white and blue. That's what me have to do. You meet the water dirty, you know it make it settle. And then you jump beside, you don't dirty and more. Thief man, they all a thief now, this is them batter. Salon they go behind, who that now we go believe. Oh, this na wrong side life, now we dey live so. If they are like thief, who that now we go believe. This na wrong side life, now we dey live so. Sorry, sana, 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 self, sana, sorry. Oh, this na wrong side life, now we dey live so.
This is to
This